let's take you back to this study that has found that children in sub-Saharan Africa that are hospitalized with COVID-19 are dying at a faster rate than their contemporaries in the US and Europe. We're joined by Professor Refiloe Masekela. Professor Masekela, I understand we've got you back up now on a better line. Good evening to you again. Of course, I was asking you the question, why is it that children on the continent and in sub-Saharan Africa in particular seem to be worse affected by the COVID-19 pandemic?
Good evening, Kathy. Apologies for the technical glitches. Well, we always were concerned about what outcomes would be for children in Africa because, as you well know, we have many challenges on the continent. Firstly, the vaccination uptake has been very low, and not only because people do not want to be vaccinated because there's poor access to vaccination. Secondly, one of the biggest challenges that we have on the continent and even in South Africa is actually access to specialized care. So in some contexts, in some countries, there's also challenges with just basic oxygen availability. And as you know, with the COVID-19 pandemic, this became a really important commodity. We also have challenges with access to intensive care facilities. So in many countries, there's very limited access to ICU beds. And we found in the study of over 450 hospitalized children that over a third of them actually required intensive care unit admission. So due to these very limited facilities, we really think that what we found, the very high mortality, may be related to poor access or very late access. If people do access these facilities, they probably do not get access timelessly because of the multiple limitations. Mm-hmm. And what we also found was children that actually died, a lot of them actually had other comorbidities. That is, they had other chronic diseases like hypertension, oncological diseases, hematological diseases like sickle cell anemia, chronic lung diseases, very different in Africa to other continents, of course, is we have a very high burden of TB, and TB can also cause a significant damage to the lungs. And of course, you've got a high burden of HIV in the continent, which really compromises people's immune system. So there may be a multiple of factors that are causing this high mortality.
There are a couple of factors I want to pick up on, Professor Masekela. First is the disease profile of, some of those pediatric patients that would have come from the region versus those elsewhere. What's the biggest difference in terms of the kind of comorbidities that these young people faced?
Well, as I've mentioned previously, things like sickle cell anemia are really very common in Africa and not in Europe and the UK, for example. Tuberculosis, which is very high burden. South Africa actually has one of the highest incidences of TB in the world. HIV infection, malnutrition, which may be a very important factor, which is not really described in many studies from elsewhere. So our disease profile, as well as the profile of our children, because most of them would come from very poor socioeconomic backgrounds, different exposures than children in Europe and elsewhere. So we know that the majority of children that would be seen in this context would be slightly different to what's in Europe or the UK.
So given the fact that there are all of these challenges that culminate either as a result of scarce resources or even just, lack of quality care that resulted in contributed to the losses of these lives, what do you think are the biggest lessons that governments can be taking out of research such as this?
Yes. So I think, Kathy, the biggest lessons that we found from the study was firstly, young children under the age of 1 died far greater than all the other age groups, 5 times more than adolescent age groups. The older adolescents, 15 to 19 years of age, also are the ones that are also at risk of death. And we saw that children who had other conditions, so as I've mentioned, the hypertension, chronic lung disease, hematological diseases. So the message is for those children in our content especially who have comorbidities, those should really be targeted for vaccination. So even in a context where vaccine access is limited, we really recommend that especially for that 15 to 19-year-old age group or any child who has any comorbidity, those children really should be fast-tracked for vaccination because they're the ones that are at risk of dying. And we found that as opposed to Europe or the US where the mortality is about 0.1 to 0.5%, in this study, 8% of children died, over 8%. So really targeting the children with comorbidities for vaccination is really key, and also making sure that we protect those very young infants under the age of 1, taking all measures to prevent them from being infected because the outcome is very poor if they get infected and get hospitalized. So those are the key messages I think, for policymakers.
Pediatric pulmonologist and head of Department of Pediatrics and Child Care at the University of KwaZulu Natal, Professor Refiloe Masekela.